are joining us today, particularly our presenters who are located in Rome. So welcome, everybody, to the last webinar of this year. This webinar have the objective of training all the private and public sectors, as well as other institutions, in the prevention and the response faced with the African swine fever and other cross-boundary diseases. Today, we have a very interesting webinar, which is the epidemiological response when faced with a case and there's suspicion of a case. I'm Erika Calderon. I work for the Inter-American Institute for Cooperation on Agriculture, ICA, and I will be your moderator today. So we're going to start with today's webinar with the opening remarks by Katia Martinez. She works for the Animal Health Organization, and she is the sub-regional representative of AMSA for Central America and the Caribbean. So, Katia, without further ado, I give you the floor. Thank you. Hello, good morning, everybody. I'm just going to give you a few opening remarks. For me, it is a great pleasure to welcome you to this very last webinar that we have held to exchange information. This is one of the most relevant ones. And of course, all of them have been important depending on where you work and what you do. Whether this is the epidemiological research and faced with the suspicion of a case. So it is a great pleasure, definitely, to welcome you all to participate in this activity. This initiative is done within the staff context faced with the outbreak of African swine fever in the region in 2021. It is very, very important for us to think about developing the capabilities in animal health in all countries. And after working on swine fever for a year, now we have the avian flu. And so we know that it has had some very important impact on those two production sectors. These webinars, we believe, provide us with a great opportunity to give updated information and facilitate the exchange of experiences among experts and professionals, both in the public and private sectors, for the countries in the region. It is very important to highlight the collaboration that we have had as international organizations to support the countries at the national level. And we hope countries will be able to strengthen their national response mechanisms so that all of these can be integrated to be able to respond adequately to these diseases in our countries. I thank you all for your participation and your commitment. And I am very sure that this exchange of knowledge among experts and professionals will be key to move forward in attaining the objectives established by all of our organizations for everything that has to do in improving the welfare and the health of animals around the world, as well as the health of humans. So I wish you all a very fruitful and good webinar. Welcome all. So thank you very much, Dr. Katia. To continue with our opening remarks, now we will listen to Dr. Gavin Peters, who is the Director General of the Agricultural in the Caribbean, of CAFSA, sorry, in the Caribbean. So Gavin, the floor is yours. Thank you.
Thank you, Erika, and good morning or good afternoon to everyone who are joining us, wherever you are. And it's a pleasure to be here to just say a few words of welcome to this, as Katia would have said, our last webinar in this series that we have been conducting over the last almost 2 years now, uh, since the outbreak of African swine fever on the island of Hispaniola. I hope that this series would have been helpful to you and to the veterinary services throughout the hemisphere. And it is a hope, and it demonstrates the collaboration that we have been having with all of the organizations, the interagency group that organizes and puts on these webinars for the benefits of all of the hemisphere. We hope that the information that was provided were useful and you could have enhanced your capacity to confront and prepare for the possible entrance of these devastating transboundary animal diseases. I wish that today's webinar in specific, that is looking at epidemiological work, would be also benefit to you and your team, and that I am here in Trinidad at a disaster risk reduction workshop where we are looking at the response of the region to, for example, the volcano eruption that occurred in St. Vincent and the Grenadines. And it's a similar intention that we have in organizing these webinars, how we, from a regional perspective, can assist all of our member states to be able to prepare so that we can be better able to confront these eventualities if the diseases do enter our countries. So we looked at the collaboration that can occur through these engagements and the systems that are necessary to be developed so that we can build stronger institutions in our countries. So with that, I want us just to share and to welcome you so that we can have a very productive webinar. And I wish you all the best. Thank you.
Muchas gracias, Dr. Peters.
Thank you very much, Dr. Peters, for your words. And with that, we have opened today's webinar officially. As it was said before, this is the effort of an interagency effort or group made up by different agencies at the regional, sub-regional, and international level: CARIBET, CAFTA, OMSA, CAN, FAO, CVP, USDA, OIRSA, OPEC, and ICA as a coordinator. So we work under the framework of the UFTAX, and we are the training group for African swine fever. And we have tried to include examples not only for African swine fever, but also other cross-boundary diseases. As it was mentioned before, we have spent more than 2 years now developing the monthly webinars for all of you. And hopefully we will be able to continue with them next year with more information for you. We have also developed a platform that gathers all this valuable information in all these webinars. So later on during the webinar, we will be sharing with you the link to this platform. This webinar is being broadcasted in Portuguese, English, Spanish, and French. It is being broadcasted in the social media, and the questions should be asked via the Q&A chat box or the regular chat box. So you have the opportunity that throughout the presentations, you can then send us your questions so that we can have a Q&A session at the end together with all our speakers. So as I mentioned before, today we have a panel of experts who have great experience on this on the topic of epidemiological research. And we're going to have Dr. Andriy Rostalny, who works for the FAO and who will be giving us a presentation on epidemiological research when reporting a suspicious case. We're also going to have Dr. Alejandro Perez from SENASA in Argentina, who will be telling us about the experience in Argentina and the epidemiological research done there. And we're also going to have Dr. Timothy Smith, who is part of the USDA APHIS, that is Veterinary Services, who will also be talking to us about US experience. So without further ado, we're going to start with today's first presentation by Dr. Andriy Rostalny, who, and I'm just going to give you a brief introduction about his experience. Dr. Andriy Rostalny works for the United Nations in Rome, Italy. In December 2021, Dr. Rostalny graduated from the university. No, sorry, since 2021. In 2001, Dr. Rostalny graduated from the now university in Ukraine. In 1997, and then in 2001, he completed his PhD in veterinary pathology, after which he worked at a faculty of veterinary medicine of the NAU, and he joined the Food and Agriculture Organizations of the United Nations at its sub-regional office for Central and Eastern Europe in Budapest, Hungary, in 2005. First, as a consultant, and then as a staff member in 2007 as Animal Production and Health Officer. For the past 12 years, Andriy contributed to the development and implementation of the animal health and livestock production programs in Eastern Europe and in Central Asia. Since the emergence of the African swine fever genotype 2 in Georgia in 2007, Dr. Rostalny has been part of a team leading AFO's assistance in ASF control in Eastern Europe. He developed and supervised the implementation of several FAO technical cooperation programs on improvement of veterinary systems, transboundary animal disease management, and regional networks, as well as a specific project aimed at ASF prevention and control in Ukraine, Belarus, and Moldova. In cooperation with European Bank for Reconstruction and Development and the FAO Investment Center, Dr. Rostalny was part of the team for development and implementation of joint projects on ASF risk mitigation for the swine production sector. In the autumn in 2018, Dr. Rostalny moved to FAO headquarters, the Emergency Prevention System for Transboundary Animal and Plant Pests and Diseases for Animal Health, EMPRES, supporting development of policies and strategies for prevention and control of priority transboundary animal diseases and zoonosis, and helping in implementation and delivery of EMPRES program. He serves as the chair of the GFTAD Working Group on ASF and leads works on implementation of the initiative on global ASF control. With this amazing experience, Dr. Rostalny, I give you the floor. Thank you. So that you can start with your presentation. Thank you.
Thank you, Erica. Thank you for introduction, and ladies and gentlemen, dear colleagues, it's a pleasure to participate in today's webinar and to basically have opportunity to share some of our experiences on African swine fever prevention and control, and maybe to have opportunity to discuss some of pertinent issues, questions for emergency preparedness to ASF and other similar swine diseases in your region. And when we talk about African swine fever, the proverb that 1 ounce of prevention is worth pound of cure is really just about African swine fever, because prevention is much better than control in absence of safe and efficient vaccine, and considering other peculiarities, characteristics of African swine fever virus. So today we will talk about epidemiological inquiry and its practical aspects of epidemiological investigation, some quick precautionary measures related to quarantine and movement control, communication, risk communication, and communication at suspicion, and some of challenges and lessons learned related to African swine fever. So at the beginning, just to mention that the precondition for strategic approach for epidemiological investigation and implementation of measures are based on the biology of virus and epidemiology of African swine fever. So we should take into account knowledge about ASF, in particular clinical disease, clinical course, and clinical signs, as well as postmortem changes, level of mortality and lethality, contagiosity, resistance of survival of virus, or better to use terminology, tenacity of virus in environment, and ways of transmission of virus, as well as human factor and value chain aspects for the epidemiology of the disease. So the epidemiological inquiry, which is a major focus of today's my presentation and this webinar, shall aim at identification of likely origin of disease and means of its spread, calculation of likely length of time the disease has been present, so-called high-risk period, identification of establishments and epidemiological units, food and feed businesses or animal byproduct establishments and other high-risk locations, obtain information on the movement of animals, persons, products, vehicles, which could have spread disease during relevant period preceding the notification, and obtain information on likely spread of disease in surrounding environment, including in the presence and distribution of disease vectors. So basically, we think about the tracing backward and forward. Backward to define how, when the pathogen has been introduced into holding, and reconstruct spread of the disease within holding and estimate the high-risk period. And tracing forward, where did the pathogen escape, and identify the contacts, and do kind of forecast for the tracing forward, with basically an aim to establish control area with two zones, infected, or also called protection zone, and also surveillance or buffer zone around the outbreak to ensure rapid and effective containment of African swine fever. So when we prepare and implement the epidemiological investigation, we need to consider anamnesis, information which we collect from the farmers or stakeholders involved, like hunters, for example, in Europe. But this is very biased information. We should think about the precision of this information, reliability, and more rely on epidemiological facts related to the tenacity of African swine fever virus, routes of infection, susceptibility of pigs, and in case of your region, I think susceptibility could be quite high because it's a new pathogen, and also contagiosity, which is not very high for ASF, although it's like spread to all continents. But usually when virus appeared in herd, it's very slow spreading within farm and from farm to another farm. Also, we need to consider incubating period of this virus for sus scrofa. We all know from OE terrestrial code that it's from 4 to 19 days, but we have an average estimation as 15 days for incubation period. We need to understand the excretion, how virus could leave the body of infected pigs, and also immunity at individual and herd level, clinical course of the disease, individual per animal or at herd level, case fatality, morbidity and mortality rates, latency, persistence, and carriers, and also it's number 11, but it's one of the most important diagnostic information. And when we consider, we basically have a hypothesis when we get when virus introduced, what time. And we need to define this high risk period. And while doing that, we think about the way of entrance of virus. So it's mostly from the experience in Europe and Asia, it's swill feeding, feeding of pigs with pork or residues of pork, which has a viable virus. And the second way of entrance is trade of pigs in prodromic phase when there is no clinical signs. And also in Europe and in some part of Asia, it's also contact with wild boar, either with wild boars or with wild boar bat, when basically they die, and you know, this infected place in environment is very important for the transmission of virus. And also fomites, contaminated vehicles, instrument, people's clothing, and also vectors, which could be specific vector, Softix ornithodorus, or just mechanical vectors, which also there is a possibility for such way of transmission, but it's not very important when we categorize them, but we cannot neglect all of this likely origin. And then we need to have a toolbox. We need to know where our pigs are located. We need to map farms or villages with this susceptible population. And we need to have a laboratory result and timeline of clinical events when we had the first suspicion, and that we need to reconstruct in time. We need to understand the data on morbidity and mortality, and the record of any movements of animals or people, equipment, vehicles, and while we are doing that, when we build our hypothesis, we also need to look at biosecurity level of this farm where we suspect African swine fever, to see what is the biosecurity level in terms of premises, buildings, fences, filters, but also what is the culture and practices of these pig farm workers. And that could be not even pig farm, it could be slaughterhouses or markets or other value chain nodes for pork production and value chain. And of course, we keep in mind that virus is pretty resistant to wide range of temperatures and pH, especially in protein-rich media such as dead carcasses, blood, meat, and even in environment. So we need to consider it when we do epidemiological inquiry. And we need also, as I mentioned, to think a high-risk period in terms of the farm size, So for the smaller backyard, we might be quicker to identify this high-risk period, which could be smaller, could be 1 week, could be 2 weeks. For medium and small commercial farms with less than 150 pigs, it could be 2 to 3 weeks. And for large industrial farms, it's quite challenging because this high-risk period could be very prolonged, because it would be difficult to distinguish between normal acceptable mortality and morbidity from actual African swine fever outbreak. So the high-risk period could be more than 4 weeks. And then, as I already mentioned, it's important to rely on findings from the laboratory testing, from detection of antigen by PCR test and antibodies by serology. And then based on the result, it could be positive for antigen and negative for antibodies. So it could be maybe less than 12 days when when animals died and sampled before 12 days. And it could be both positive for both antibodies and antigens, could be more than 12 but less than 24 days. And it could be negative for PCR for antigen detection, but positive for serology. And that could be more than 24 days. Or animals were sampled after 24 days. So we need to reconstruct, like going back forward, and to consider all these information, epidemiological facts, which would enable us to better understand or have a more appropriate hypothesis for the time of and mechanism of introduction of African swine fever virus. And now I would like to say a few words about the geographical information system and use it for epidemiological investigation and also disease management. As we all probably know that geographical information system is powerful technology helping to bring epidemiological investigation and disease control in general to a much higher level. And appropriately and correctly designed GIS can significantly improve your epidemiological investigation and give much better understanding of the outbreak context and its scale, and to better, in general, manage outbreak. So basically, some of tasks where GIS is instrumental include anticipation of risk based on available knowledge on the susceptible population, what is likely to happen if the virus is introduced. And for example, this slide, you can see maps of density of domestic pigs and wild boars in Ukraine, which identify weak spots where there is large backyard population or of domestic pigs, or where there is high density of wild boar. And it could be done even before we have suspicion of ASF. So it would help very much to understand epidemiological context and build reasonable hypotheses. But also anticipate implication of disease event when it suspected or when it confirmed. And most important, as I mentioned, is tracing back and forward to understand risk contacts. And as we know, trade in live pigs and pork products is extremely important risk factor for African swine fever. And basically, provided with geolocated information on patterns of movement of pigs, one can get a clue for the investigation, where to start investigation. On this slide, you can see some of our work in Philippines, which basically show the officially approved movement of live pigs in Philippines between provinces. And it's extremely important when you have suspected case or confirmed case on how this movement is directed, what is the trend, where there is the biggest production and where is the client for this pork, how it moves. That's really simplify and make it easier for the quick analysis of different hypotheses and making a decision on what to do, how to respond. As I mentioned, it's important to define the zone, because zoning and evaluation of risk is a part of any epidemiological investigation. And it doesn't matter if it's African swine fever or any other infectious disease outbreak. So GIS comes very handy with creation of radial zones, infected surveillance zone, as well as prompt application of sophisticated risk mapping approaches. That also could be modeled in time, so you can see it in dynamic maps. And you can define your protection surveillance zones, define your farms, villages, and much more quicker establish your quarantine posts and conduct necessary surveillance activities and any other activities which you need to do. And on this slide, you can see some of our work in several countries in Southeast Asia, supporting countries with decision-making for African swine fever surveillance and control. And this also includes some information on the market and value chains. Some of also risk assessment can be done, as I mentioned, in time of peace, which help to speed up investigation when disease incursion happen. And one can, for example, create predicted suitability map for endemization, for endemic persistence of virus, for example, in wild boar. And this map on the right side is example from Ukraine, based on wild boar numbers, landscape transformation index, and temperature. And another example is similar suitability creation map for the wild boar and backyard pig interface. So it's important to see where is highest risk for backyard domestic pigs and wild boar interface, and to improve biosecurity, improve surveillance, and other action. So here you see some maps from Cambodia and Laos. And of course, this will be part of our publication. So soon we will have handbook on how to apply GIS for African swine fever disease management. Currently, it's under peer review, but once it's published, it will be also translated in Spanish, French, and other languages. And we plan to transform this publication in more handy virtual learning center training, where people who are working on GIS and helping veterinary services would be further trained on how to apply all these tools for African swine fever. Now, to say a few words about the some of biosecurity aspects, which when we in rush, when we are stressed, sometimes we and our colleagues forget about biosecurity, and it's important to have idea on how to organize it, and better to do it in the peacetime before outbreak. So for the arrival on site, it should be the contamination protocol for vehicles and personnel upon entry and exit, following very basic three biosecurity principles of segregation, cleaning, and disinfection. And again, this is this example, which I just showing you now, is based on very extreme virus, very extreme case of FMD. But as we try to reach the most optimal way in terms of cost investment, that should be adjusted for the African swine fever. But general principle should be followed. Before departing to the suspected farm or farm confirmed with ASF, we need to remove all unnecessary equipment for the car, arrange clean and dirty areas on the back seats, and in the boot of the car lined with the plastic sheeting. It could be any kind of plastic which you fix. And make sure you bring all necessary equipment with you, and also it's helpful to have a checklist. So example of checklist could be, I demonstrate in this slide so you can use it for better preparation. And then on arrival, the car should not be driven into the premise. You need to leave it near the farm entrance. You should choose suitable location for your disinfection site on a clean and dry surface, preferably concrete, and using clear demarcation between clean and dirty sites. Remove all unnecessary clothes and items and empty your pockets. And electronic equipment, for example, your mobile phone needed, which you would need on the farm, should be placed in sealed plastic bag to facilitate subsequent cleaning and disinfection. Phone should never be removed from the bags while on the farm and should be only used through plastic bag. You need to remove all from the car all items needed for disinfection that are to be taken onto the farm. And also sometimes there is issue to get water to make disinfectant solution. So you need to think about water just in case. Then when you arrive, also you need to have to prepare in order to enter, and you need to lay down a plastic sheet on the clean side of the disinfection side, place the items you will be taking with you to the farm on the dirty side on the disinfection side, using black plastic bags, for example, and sample container. Make up 1 bucket of detergent and 2 buckets of disinfectant with water, which you brought, and the detergent and 1 disinfectant bucket remain on the dirty side and will be used to clean off dirt picked up on the farm. And other bucket will be on the clean side with its own brush. And disinfectant used will often be disease specific. So there is a list of disinfectant which is recommended for African swine fever virus. And concentration and contact time required should be also carefully monitored. On arrival, also on the clean side, you should take off shoes and leave them on a plastic sheet. Disposable suit goes on the first and fits inside boots. A set of gloves should be tapped on. Waterproof suit required for weather condition, which goes over the boots, and it has its own layer of disposable gloves, which can be changed when soiled. Overshoes should be worn to cover at least the soles and lower part of gumboot. And before leaving, undressing or leave site, before leaving the premise, use farm-owned facilities to clean very dirty areas. Then clean sample container with detergent and brush before soaking in disinfectant for appropriate time. Then place in sample bag on clean side. Wash off and disinfect bag containing the phone and similar items taken from the farm. Remove boot covers and dispose in dirty side plastic bags. So you follow basic principle of segregation, cleaning, and disinfection. Then you continue undressing, also following this principle of segregation, cleaning, and disinfection. And on clean side, you step out of boots into clean side sheet before grabbing boots and disinfecting them on a clean side with another disinfection bucket which you prepared prior to entrance to the dirty zone. Lastly, place them in a clean side bag. Hands and glasses are also disinfected here, as well as your face. No disposable equipment and samples are double bagged and tapped. In dirty side buckle and personal, they should be disinfected and double bagged before being taken away. Any buckets from the farm must stay on the dirty side, and bags can then go into vehicle's dirty area. On the clean side, you should also do procedures, to minimize escape of virus. So they are very basic and logical, and basically you can follow them also on video on YouTube. Just returning to these biosecurity measures, from basic experience, what we have, proper cleaning reduce risk of transmission of virus maybe by 90%. So you should really pay attention to cleaning before you apply disinfectant. And this sometimes not taken into account, but when you have first time in your country, you really need to make sure your team, your colleagues apply these biosecurity measures. So now a few words about sampling procedures. Again, you need to follow specific biosecurity guidelines for secure samples. You need to have designated kits, which you need to prepare in advance, and adherence to the age rule for animal handling. You start with drawing whole blood from jugular vein, also inferior vena cava or the auricular vein from ears, using sterile tubes, containers with anticoagulant Ideta purple stopper. For Sera, you can use also sterile container without anticoagulant, which is marked with a red stopper. And also, if you would plan to use your PCR testing, which is probably the case, or hem-adsorption reaction test, please avoid use of heparin. This slide shows you preferred samples and conditions and advantages of different samples. In principle, from practical term, whole blood with taken, as well as lymph nodes and spleen. And sometimes we don't have it, we have just marrow bone, for example, for carcasses which are rotten, so you can use just bones with marrow. And there is OE, VOA manual on diagnostic tests and vaccines, where you can find more detailed information, as well as from reference laboratory network, which will provide you all the details. Again, it's important, as I already mentioned, time when you suspect disease, and at the beginning, when you don't know, you need to have, if you have alive animals, you need to study both for the serology and antigen detection. In practical term, it's usually testing for antigen for using real-time PCR as the most quick and reliable test, because we know that antibodies not always detected or detected in low titers. So we also need to comply with packaging, especially when your countries ship abroad samples to reference laboratories. So you need to comply with International Air Travel Association, IATA, and also you need to have relevant documentation and labeling with declaration and labeling for dangerous goods. Also, tamper-proof sealing and secure storage during transit, restricted access to the sample throughout the whole transport process. And FAO provide assistance to member states with provision of kits for the packaging and shipment, and facilitate shipment to reference laboratories. Also, for countries which want to have a quick test in the field and and there's an issue whether it's absent conventional laboratory at central level, or it's just a matter of urgency of time. Various point of care testing now available with advantages and disadvantages. For example, rapid test, lateral flow devices, screening test or pen test. Unfortunately, sensitivity is low to moderate, specificity high, and it's quick test, but not so much reliable. There is also isothermal testing using lamp or pocket with higher sensitivity and higher specificity, which basically applied by many countries already. And there is mobile real-time PCR, and also have quite good sensitivity, quite high sensitivity and specificity for on-site diagnostics, for example, for authorization for movement, for biosecurity checks. And as you see, they quite quick and could be done in a fetal condition. You can see our colleague Agata Hour doing testing with basically mobile PCR, a real-time PCR platform in Tanzania, assisting Tanzanian colleagues with African swine fever outbreak. Also, we have quite good experience on field application in the field in Southeast Asia, using some of these tests. Now let's move for the next part related to precautionary measures related to movement control, which should be also done in peacetime with proper legislation and condition, and also enforcement capacities, how local authorities can implement them, and it should not be done just by government, but in cooperation with private sector. And the good communication. Why we do this movement control? Why we do quarantine? What do we want to achieve? Because we know that it's very expensive and it's very painful for farmers, for traders. So they need to understand why we are doing that, and we need to do it in a way that it has minimal impact. And from experience, the well-organized quarantine movement control of short duration are likely to receive more popular support. So usual things, what we do is we put infected or suspected farm under immediate quarantine. So meaning no people, vehicles, animals, or pig products should enter or exit the farm until diagnosis is confirmed. Establish disinfection point for people and vehicles that enters and exits. And also dangerous contact like neighboring farms should be notified to enhance basically monitoring and report any symptoms, and also enclose them and stop movement of pigs and products in and out of their premises, or offer them another option to mitigate risk, like slaughtering and processing of pigs. There is also movement restriction that even adequate cleaning and disinfection is done. Personnel participating in outbreak investigation should not visit another farm for at least 24 hours. But it's practically very difficult to implement due to lack of personnel. But we should aim, if we have sufficient personnel, if we, for example, use personnel from other provinces, it's more preferred option. And when facing outbreak affecting free-range and scavenging pigs, which is the case in many countries, the first step is to immediately bring back all non-confined animals and keep them enclosed. At least for the time of, when we define the surveillance and protection zone, when we know where the highest risk. So temporarily, we need to confine all non-confined pigs. And there is measures which we apply in case of suspicion. I would not read all of them. You will aware about them, related to high risk contacts. It could be animals, it could be meat, pork, it could be semen, ova, embryos, or contaminated by virus animal feed. So the movement control personnel in vehicles should be also subject to written authorization, and it should be clear who can enter facilities and who can not. And also it's important to have a proper communication. It should be established timetable for communication between command level and the field level. And this should include information flow, and communication should be two-way, because as scientists and veterinarians, we often act as it's just knowledge alone enough, just saying, giving instruction to achieve result. But we deliver evidence and guidelines. We expect people to understand and follow the information we provide. However, what people know and think affect how they act, and farmers or hunters' perception, motivation, and the skills all influence their behavior. So we need to acknowledge that it's two-way communication. In order to be effective, it should reflect both facts and values, and it should be two-way communication. It's also important to avoid duplication or confusion, confusing messages. So it could be avoided by standard distribution list for reports and instruction which should be previously defined, preferably before outbreak. And it's important that upon detection within 24 hours, country notify on African swine fever outbreak to VOA, and also most importantly to neighboring countries and trade partners. There is a generic risk communication planning, and there is basic principles of emergency outbreak communication defined by WHO and VOA, based on trust, transparency, and announcement early enough to make appropriate action, and listen to the public and respond, and plan your communication for extreme demands on case of outbreak. So when you plan your communication planning, you need to answer 8 questions, determining your communication outcomes. What do you want to achieve with your communication? And who is your stakeholders? Who is the recipient? Who is audience? And map your stakeholders, and to have the right messages and point of view, and select the right channels of communication, and develop right products for communication, and also do it appropriately, to have a work plan, to have a deadline for communication, and also to have a budget and human resources expert who can help us with risk communication planning and implementation, and then also to have a feedback and to have monitoring and evaluation how effective our risk communication. So the first is why, what are the main ASF risk factors, and how stakeholders reduce them, how they change their practices, change their behavior towards ASF risk, and how we will contribute. So the generic example of communication outcome that veterinary authorities and stakeholders working together to reduce likelihood of ASF incursion and introduction. And it could be achieved by reducing illegal movement of animal and their products, improving passive surveillance and biosecurity, improving border inspection, and and other things which we want to achieve. So stakeholders are people with a key role in increasing risk and people with a key role in reducing risk, and other people whose role we don't know, but we need to define and address them in communication. And most important is whom we communicate, who are stakeholders, and we follow precautionary advocacy principles, alerting insufficiently concerned people to take this risk seriously, crisis communication, providing sufficiently concerned people with information they need to make decision and contribute, outrage management, education, engagement, and public relations. Here I would like to mention a few examples of awareness campaign, but also risk communication campaign, which developed by OOE, by WOA, and with FAO. And it targets different audiences, such as veterinarians, farmers, policymakers, general public, travelers, and so on. And it includes infographic posters, leaflet postcards, social media cards, and fact sheets available in 13 languages in Trello board. So you can access this free of charge, and most important that all of these materials are easily adjustable, so you can adjust, you can change, and you can translate it to your language and apply it easily. Then when we talk about challenges, there is a lot of challenges for epidemiological investigation, and for example, the lack of information on the updated information, current information on pig producers, on farmers, on pork value chains. There is no maps, there is no updated information on informal production and value change, like unregistered farms, traders, processors, slaughterhouses. There is also issue when you have a multiple suspicion, because unfortunately, in many cases, in many countries, African swine fever suspicion came very late after virus already 4, 5, 6 months in the country. And you really need to have a search capacity. You need to do intensive work in different parts of the country for the surveillance, diagnostics, but also for outbreak control. So there is not sufficient number of labor force, equipment, and other resources. So there is no stockpile of equipment and trained labor force. And in general, there is a reluctance of farmers, hunters, and general public to notify dead domestic pigs wild boar. And there is various reasons for that. It's fear for inappropriate or unpractical control measures from government and local authorities, which is based on culling of pigs without compensation, timely and fair compensation, and also a result of insufficient understanding of impact of African swine fever, and also other factors which affect, their willingness to cooperate and notify early enough any suspected cases. So now I would like to draw attention to some of relevant publications for the African swine fever prevention and control, including on epidemiological inquiry, where you can find including on risk communication for emergencies. So FAO published a number of these publications, including in Spanish and French languages. So you are all welcome to explore them. And I would like to thank all of you for your attention, and I would be happy to answer your questions. Thank you, and over to you, Erika.
Muchísimas gracias, Andri.
Thank you very much, Andri. Thank you for describing the entire epidemiological investigation process from beginning to end. This is for you to have a good technical foundation on how to act in case there is a suspected case and everything that has to do with epidemiological investigation. And now we are going to move to countries' examples with regards to this methodology and steps. So now we are going to continue with our next presentation. Thank you, Andre. Your presentation was very interesting. I believe that it set the foundation for everything, and that's what we needed to know in order to know how to proceed in case there is a suspected case. So now we're going to continue with a presentation by Argentina, by Dr. Alejandro Emilio Perez. And just some background information with regards to Dr. Alejandro. He's a veterinarian with a master's degree in animal health with an experience in laboratory diagnosis and sanitary programming. I believe we're listening to the French now. Thank you. So in 2018 and to date, he has been working in the General Director of SENASA's management, so SENASA National Director of Animal Health and Swine Disease Sanitary Program. And from 2009 to 2018, he worked as a General Director of Laboratories and Technical Control Head of Swine Diseases Diagnosis. He, since 2013 to 2014, worked at the University of La Plata School of Veterinary Sciences, and he obtained a specialization in biosafety and environmental prevention. And this was for a year, and between 2006 and 2008, he also was at the University of Buenos Aires in the Faculty of Veterinary Sciences as a master in animal health. Also, from 1997 to 2002, he attended the Universal National University of the Center of Province of Buenos Aires, Faculty of Veterinary Sciences. That's where he graduated as a veterinarian. He also obtained a number of scholarships from 2005 to 2008 in the Secretariat of Science and Technology, CSICT, and the World Bank. Studies to establish criteria for updating the foot and mouth disease vaccine relationship between vaccine strains and field strains, harmonization and development of techniques for the diagnosis of foot and mouth disease, its implementation under quality standards for its control and eradication. So, without further ado, and letting you know his vast experience and his work, I leave you with Dr. Alejandro Perez. Dr. Perez, I give you the floor. Go ahead, please. Well, Erica, thank you very much. Thank you very much for the invitation to participate here. I'm going to share my screen now. And while Alejandro shares his screen, I just want to remind you that we have people from Uruguay, the official sector of Belize, from Baja California, Mexico, Senacica in Mexico, from Trejo and Asociados in Canada as well, Terrada from Jamaica, SAG from Chile, big farmers of Ecuador, Senasa Paraguay, Senasa Peru, Sofedobet in Costa Rica, and ICA Colombia. So as you can see, we have a very varied audience, and we have people from the public and the private sectors, as well as from universities. So Alejandro, the floor is yours. Go ahead, please. Okay, thank you very much. Can you see my screen okay? Yes, yes, we can. Okay, perfect. Thank you. So what I'm going to be talking about is pretty much the experience of Argentina. Hopefully, this may be of use to some of you. And based on Adri's presentation, we can now confirm that some of the actions that we are undertaking are correct in terms of the pathway that we're adopting to try to establish the procedures, the right procedures. Now I'm going to present to you the manual of procedures for the notification and management of for suspected cases of of ASF. Let me tell you that this manual was already had a previous version for classic swine fever. And so as we saw that the ASF, it was introduced in this side of the world, we decided to include this part so that Argentina can have a single procedure for both diseases. These procedures and the evaluation of these procedures and the operational part of these procedures and their management is mainly under the responsibility of the National Director of Animal Health. And it is important to highlight this because probably it is something that happens in your countries as well. It has a central area that it takes care of all the suspect cases. And it also has the Sanitary Execution and Management Control Directorate. And it also has a general coordination of territorial control. And we have the technical areas like we have the Animal Health Strategy and Program Directorate, the Epidemiological Coordination, and the Swine Disease Program. So we have other areas that take care of things in the field as in the laboratories. Other of the things I would like to also give you some context are the prerequisites or pre-emergency context in case we are dealing with a suspect case in order to discard it or confirm it. So it has to do with not only the regulatory part, but also the practical part. First, we have the notification by syndromic presentation. This is highlighted because it's based on a regulation that exists in Argentina. So I just wanted to give you the context so that you can understand what this regulation is all about in terms of the symptoms and the clinical signs. So we're going to have the syndromic presentations, notification of syndromic presentations, and this will help us know of whether this is a specific disease. And that's the virtue of the management of the suspicious case. So we also need to take into consideration that in the current context, it is highly recommended to increase the diagnostic capacity that we have of the existing diseases and also the increase in the threat. So that's why we decided to increase this diagnostic capacity. Something else that's very important that we have developed during these years is training in order of relevance. And this is continuous training based on the most vulnerable sectors or those who play a greater role in the case of a suspected case or a true case. So we started working together with the official veterinary services in the region, as well as with other official services and now we are also taking into consideration students who are often neglected. These are students from the veterinary schools so that they are prepared once they graduated. Something else that we have learned is to transparent and facilitate the reporting of diseases. What does this mean? Well, to show to the sector what are the internal procedures and how to deal specifically with a suspected case and how to identify it. We have also increased the number of ways to notify cases, not only using the classic ways or pathways through the local office, but also through applications and online questionnaires. And also we have incorporated a bot that helps people to do the reporting via pig farmers or other stakeholders. Then also, in order taking into consideration what has been declared globally, we have adopted the Declaration of Health Emergency due to ASF, and this has had a very important impact not only at the veterinary service level, but also in the general public and other official public services. So it is very important because then it is taken into consideration when we talk about passenger transportation and merchandise transportation. Also, we approved recently a PPA contingency plan with many of the things that were mentioned recently and taking into consideration the different aspects of the sector when an emergency is declared. There's a mistake. I apologize for that. It's an alert. It's sorry, it's not an emergency, but it's an alert. What was declared was not an emergency, but an alert. I apologize because I just realized I made that mistake in the slide. And also, the development of the formation of emergency teams in the field. What does that mean? Well, it means that we have people responsible in the field for each of these steps. And this helps us also have an inventory of the emergency teams. So they all have to have a list of what are the elements that they should have in order to face an emergency. And they also need to take into consideration that these inputs, materials that are needed had to be dedicated only for emergency situations because sometimes, we have the equipment, but they are used for other purposes and other situations, more daily situations, and they are not reserved for a special occasion like in this case, when the demand for such input is going to be greater. So this is something that we need to keep in mind all the time. And now let's take a look at the PPA Suspicion Management Manual. First thing we need to take into consideration is to define the target audience and the circumstances that may be found where the technician, the professional might actually find in the field and look at the different situations and not just do this theoretically. And the study, the pig population. So it has to be both domestic and wild. In this case, how is this manual going to be referring to all these things? So also, we also take into consideration that we need to introduce the personnel in into the different situations that they will face, because the disease may present itself differently, and so we need to give professionals the information in an organized manner so that they can definitely, at some point, they may be entering a different point of the disease, and so what they're observing needs to match with the time they are observing. So it is important to describe the course of infection because we don't know at what point we're going to reach this suspected case. So the dynamic of the inspection is very important, and the time how much time the clinical signs took to appear, and other things. And here we can see the difference between the hyperacute form, which is the most typical presentation, because this is a presentation of ASF and not classic swine fever. In the case, then we have the acute form, the subacute form, and the chronic form. We also need to look at the period of high risk or high risk period before evaluating the clinical signs. We need to contemplate the dynamics of the infection to understand the epidemiological indicators. And for this, we need to take into account the standard presentation and compare these two diseases, the classic and the African, and look at the dynamic of the infection. And with those same indicators of morbidity, mortality, and lethality, we can look at where we are, and then we can follow a different dynamic and look at the time frame in a different way and see what is going on. So this chart was taken from that reference, and it's available publicly. Other of the things that were mentioned was to explain the transmission and the viability in the environment, the situations where we're going to see the virus being transmitted. So as it was mentioned, for example, feeding with contaminated waste without cooking, contact with fluids excretion of infected pigs, contact with objects or vehicles that were on the establishment with infected pigs and therefore contaminated animals, and the contact with infected feral pigs or wild boars or their carcasses, which is very important. And this chart that we see here, and it's very relevant in this disease, is see what we have in the environment. If there's a suspected case, we don't want to rush, right? Of course, because people might not be there, but this information is very important to report, and also because it is going to be kept and confirmed. So this is information that we will be able to use further on when we need to restrict products or vehicles or motion of animals and people. Also, or the movement of animals and people. Also, we included the location of susceptible wildlife species. So we're using georeferential systems and mapping. And here, what we're talking about is the type of tick, the Ornithodorus rostratus in Argentina. And what we can see in the images is the first map on the left, the places where the tick lives. This is a personal research. This has not been published yet. And the dark dots that we see here, we confirm that they are located in these places, in those environments. That's where this species has been located. And these images are courtesy of Dr. Santiago Nava, another scientist who dedicates himself together with other researchers to study ticks. And here is an instruction manual on how to catch these insects, so you can identify them and see if they're present close to a suspected case. And then also something else that we look at is the wild boar. Here we have the color map where this animal lives. And so this is because people report seeing them or because there are surveys that confirm and validate this model showing where they live geographically. So this is a kind of an extreme confirmation of where the wild boar may be located in areas where there's agricultural production, for example. And there's something else. This slide has lots of information, but what I want to highlight here particularly is that it is important to define the definition of suspected ASFs by signs and lesions or also by epidemiological nexus. So in this case, the tool that we use, because this is a disease that has many different presentations, is to look at the acute course and the chronic course. In the acute course is the one that we're looking for mainly. What we differentiate here is some of the symptoms, the appearance of some main symptoms, such as that may be what raises the flags. So it's not a syndrome, but more specific signs of the disease. Obviously, I didn't show everything in the slide, but they're available in the manuals and the procedures. So everything has to be described, what are the differential diseases that many of us know about, but I didn't add it here. There is also a chronic course, and that's something we need to take into consideration. And we need to see that in wild pigs, these clinical signs are similar to those of domestic pigs. There's absence of escape reflex, tremors, hindbrain paralysis, and other neurological signs that are also observed. And some animals that may, and wild boars are found dead in most cases. And this may be considered as a suspicion. And it's worth taking a sample from these animals to be sent to the laboratory and discard the suspect case. So then we have the definition of suspected AFS by epidemiological link. This is where the disease has already entered, and this is something we need to mention because it's still a suspected case. So when the disease is already in a territory and the pigs have been in direct or indirect contact with a pig farm that is infected with ASF or classical swine fever, so once the disease has been confirmed in the feral pig population, the pig farm must be located in an area where wild boar and feral pigs are frequently sighted, and or if these animals enter the farm frequently, and they're usually seen there. And also, if it is detected that the animals are fed with waste or feed from abroad, it is aircraft waste, ships from countries where the presence of the disease has been confirmed. Of course, these are very specific situations, so they may also be exceptional, but it is important to keep them in mind because this is the way in which the disease has entered many countries. And this scheme here is a bit summarized because previously this was done through a different type of chart that was too complicated. And so this is much more user-friendly. But in general, it describes the general instructions for notification and attention to suspicions for all the diseases, as I mentioned before. When first we have the classic procedure, and then it has different particularities. We have the notification, suspicion, the noticing, recollection of materials, all the different steps that have to be taken in the farm, in the local office, in the terminal, and at the central level, and at the laboratory. And this, at the same time, tends to be dynamic based on how the disease works and the suspected cases that may be received at a certain point in time. So we need to take into consideration that it shouldn't be fixed or rigid or written in stone, but it can be flexible and adapt in order to manage the information. So this is just to reinforce what was seen before: the sequence, notification, suspicion, attention, diagnosis, and finalization as the chronological order in which this is carried out. Then a number of things that have to do with the attention to the suspicion in the way we have developed it. First, we need to define the epidemiological unit based on different situations, such as a number of establishments of originary peoples, a community, or a very different situation, such as an integrated farm that has different sites for production within a territory that may be several kilometers long. So this is something that we need to do first, define the epidemiological unit. And in a preventive way, we propose the blocking of animal and product movements before confirming or discarding the suspicion. We have the obligation of doing this within a 24-hour period. So in this context, the blocking is preventive before even visiting the establishment. So here we collect information that has to do with verification, the existence of different animals, different species, their movements. And so this is a collection of data also from records. We can look at back 2 to 6 months, depending on the situation, but the idea is to collect this information. When visiting the establishment, we need to inspect it and look at the establishments that may be in a radius, maybe a 1 kilometer radio or 6 kilometers radio. This is something that we need to define. First, we start by 1 kilometer to survey the area and see what we're facing. And of course, we need to take into consideration all the recommendations in order to inspect the establishment, and those have to be in writing. Then we also have the biocontainment measures, like personal protection equipment that they have to be available. Also, what is going to be our sanitary barrier, all the different elements and the point that we're going to be establishing as in order to inspect the place, and also the disposal of carcasses, how we are going to deal with this in that establishment, even though this is still a suspicion. And once we have all this information, we can establish the different areas. And based on all the information that we have obtained throughout the years and our trainings, we can, in a generic manner, establish different areas to organize ourselves in the flow in diseases of this kind. That because there may be contaminated elements, animal secretions, blood that would have an important viral load. So it is very important to establish these areas, establish an area for cleaning and disinfection, a security perimeter, a place where we're going to park our car and then move, as it was mentioned before. And also in production sites, we need to have also the areas where we're going to be separating the animals that are sick. And here we have a very practical example of how these areas will look like. This is a farm that is not really extensive or intensive. This is just a demonstration farming. This is an experimental farm, just to show you the different types of production technology. So this is an example that may have some errors, but it definitely helps as an example. And in order almost to conclude, with regards to how we pay attention to suspicion, it is important to have the introduction of the establishment, everything that has to do with the legal aspects through a document. This is a legal document. You may have a template or different types of documents that may help to record what was done, but this may be done differently in each country. But there's always got to be something legal, a legal record. And because then this might lead to a compensation or indemnization. So it is important to have everything in writing. We also establish the movements and transfers with authorization, and we restrict movements if needed be. Of course, when it's confirmed, this restriction, when it's a suspicion and it's confirmed, then the restriction of movements is there. It's needed. And so we use the IT sanitary systems and everything that has to do with signaling and different areas. And also, these are often things that happen in the open air, so the barriers might not be easily found or established. So it is important to have this type of materials to mark the limits. Then carry out a census and isolate the animals that are sick. Take the samples, so do the sample collection and separate healthy animals from sick animals. And this will, of course, will depend on what is being happening. It is important to do the first contention for the first contention of the disease and adopt measures and continue surveying and monitoring the development of the disease. Something else that's very important is sample collection. another separate item that we may have here. It can be an annex, but it has to be well developed. Then registration and notarization. Not to forget that everything needs to be logged on a notebook or something. It has also to be recorded in the right places and in the right way. That is something we always need to keep in mind when giving people instructions on how to protocolize all this. And then epidemiological and biosecurity survey, that is very important with regards to this. We need to understand that we should not be too strict with this survey, at least based on our experience. But you cannot leave everything free. So you need to find a commitment and find a middle ground and see which are the right questions that should be included. But there's always some margin for asking certain questions that can oftentimes make a difference. So we need to gather a certain amount of information that will help us determine how the disease entered, if it was confirmed, or how it is disseminating to adopt preventive measures based on these characteristics, and also the biosecurity aspects. Just in the same way, we all know the security measures and what they should look, but oftentimes after the survey or the interview, you need to carry out a training of those who know more and towards those who know less. And so think about the questions and the key questions and how you ask the questions and the key questions that you need in order to obtain the information that is necessary to discard or not the suspicion.
As to sample collection, I will be very quick. Additional procedures, we always have to have these very well developed. This is a completely separate process. Describe the quantity and type, that is very important, of samples, I mean. Describe how to prepare that sample with the triple container. The procedure has to be standardized and be made known to all members in the logistics. And this is very important, as well as the sample reception. This has to be very updated. No one can claim they are not aware of the mechanisms used when submitting a sample to the laboratory. And if you allow me, since this is a procedure to deal with a suspicion, not long ago, and when we were convened to participate in this meeting, we were beginning with a drill in the field, a simulation, a field simulation, as we call it, for swine diseases. And all this procedure helped us to update it, see what shortfalls existed. We always work with the disease absent, so we really do not know how we will really react and do our task when the time comes. But these are all the lessons learned. As final thoughts, and this is just a suggestion. In many of our regions, we perhaps do not have a committee of experts to help the operations center. This is very important because we sometimes are very distant one from another geographically, and perhaps there is more or less experience in one area or another. And then we hesitate in doing what we should because of this lack of experience. Before the emergency, we must define the epidemiological surveillance sampling and the semaphore controls, the route controls. This is very important. Basically, what the surveillance would be like in a suspicious farm in a given area. How many samples, frequency of sampling, representativity of that sampling to determine the presence of the virus, etc., etc. There are many questions, and this in turn basically becomes a permit to move different animals or restrict them. That is why I mentioned the semaphore, the stoplight system. If we have the surveillance system or not, if they can move to one zone or not to another, what products can cross, which ones cannot, what, as well as the breeding material. To better understand the interaction mechanisms with the security forces, national parks, and the private sector. The advantage of this is that the private sector participated very actively in our drill. And we were able to bridge some of the differences. That was very important. We were able to see the views of one and the views of the other, and we were able to compare these to the different situations that occur at farms and at the level of the sanitary service. That is very important. And oftentimes we do not know what the interaction will be like with all the staff, for example, at national parks. And so that is why we involve all these organizations that deal with wildlife. We could also include associations of hunters, etc., etc. This interaction is very virtuous. We learn a lot of what else to do beyond the theory that we could have at the office. Improve the epidemiological survey. I already mentioned this. Carry out or develop security measure videos. We saw some of these on the slides. We saw one of the videos available. Very interesting, by the way. But it is always good to be in contact with the people that produce these materials and so that they can share via videos how to react appropriately to these diseases that have so many contaminating elements that could be transmitted. And this is can be done very simply through a video. And something else related to this, because we, in general terms, consider the disposal of swill for environmental reasons, but this swill is very important for biosecurity reasons. We have to improve how we go about disposing of these wastes or residues in our activities as veterinary services. When we address a suspicious case, well, these residues are highly contaminated, and additionally, we have also seen this in the time it takes and the elements required, the distances, the permits, the disposal sites, all the biocontainment measures we need to take into account. This is a completely separate exercise. And this is something worth evaluating later. Well, this is what I had to comment. Perhaps all I needed to do was tell Rocio or Erika that at some point in the slide they had to share a link. Please go ahead and do so now, but this has to do with the interactive map available. I will cease sharing and share that through the chat, showing the wild boar and the confirmation of this model within the CBC, the three countries. So, Erica, if you want to share that, yes, we are already sharing it. So this is already in the chat available for everyone. So this is the link. And you will see the publication of the same paper. This has been published in the same group. Okay, thank you. Thank you, Alejandro, for your presentation. Very much in line, as you said, with what Dr. Andre just covered. So We see the great job you are doing in Latin America also,
experiencia que tienen nuestros países
and
en el
all the experiences our countries have in addressing
investigaciones epidemiológicas
or in all the research and suspicious cases. We are sort of running out of time, so I will immediately move into the next speaker. I would just like to remind you to post your questions in the chat. We have already received several questions, many of them which have already been responded. Allow me then to introduce Dr. Timothy Smith. Dr. Tim Smith, he works for the USDA, the Veterinary Service in the U.S. Department of Agriculture, in the APHIS office. And Dr. Smith is the lead instructor for such classes as Safeguarding Animal Health, Program Disease Field Skills course, and the Foreign Animal Disease Investigation Refresher training. Additionally, Dr. Smith is also subject matter expert for foreign animal disease investigation training and is one of the content authors for the Foreign Animal Disease Investigation Manual. So, with this, Dr. Smith, the floor is yours for your presentation now, sharing your experience.
Oh,
in
Erica,
the United States.
thank you so much for this. I really appreciate the invite and the speakers before me. So thank you. So this is a little bit from our perspective in the United States. So some background. I have been a foreign animal disease investigator for over 20 years. And when I first started, a lot of our cases were only 200, 300 cases per year. But as time went on, that accelerated, mostly in the last few years because of Seneca Valley virus. So now we're up to 1,500 cases per year. But the important part to get across is that we do these investigations as a cooperative basis with our USDA staff and our state counterparts. We, as a federal entity, have the authority to investigate these disease outbreaks because of many rules and regulations that have been put in place over the years. Our state counterparts have the authority to allow us to do these investigations. Not only that, but also to quarantine the animals that are on a particular farm. We, as USDA Veterinary Services, provide a long litany of training to our not only our staff, but to our state counterparts, our military, laboratory people, and university personnel. But we, as an entity, have the primary responsibility of doing those investigations. But like I said, it's a cooperative effort between state and federal. But because we are made up of many states in our country, the roles and responsibilities will vary between state to state. Typically, an official from USDA will contact his state counterpart, which is the state veterinarian, and they'll assign what we call a foreign animal disease diagnostician to investigate that foreign animal disease case. So one of the great tools that we have developed over the years is this FAD manual, investigation manual. And what it essentially is, it's a step-by-step outline of how to do these investigations. It shows us what samples to collect and how to send them to the lab. And as you can see, it has a lot of pictures that show us how to collect things. In this case, we're collecting a tonsil out of a pig. And then for the African swine fever dialogue that's in there, it tells us what samples to collect, how to collect those, and what labs to send them to. Now, in regards to our labs, one of the biggest issues that we have sometimes with our people is making sure that they're taking their samples with, say, blood tubes or using media that are still within date. And the reason for that is we are what we call an ISO accredited laboratory. And when we don't have those materials that are in date, then it invalidates any of our test results that we get, and then becomes problematic. So it's really important that our people in the field keep track of their supplies and make sure that everything is in order, and that they have the means to ship them off to our labs. The other tool that we've developed that's really essential is this mobile data entry ability. And that is, we can enter what our findings are on the lab, on the farm, and take pictures and attach documents into this data point on a phone and send it off to officials, whether that be our federal officials or our state counterparts or even to the lab. Now, this is great because 20 years ago, if you were to do one of these investigations, you would get inundated by phone calls all the time. What's going on with the case? What are you doing? What did you find on the farm? Well, now we can collect all that material and put that into that data point on that phone and send it off to everybody so they all know what's going on the farm. So, who reports these suspect cases? We are extremely blessed in our country because we encourage our pork producers to report anything that they may find, because we realize that it may take some time between the introduction of a disease and someone finding it. So if we can encourage our producers to report that in a timely manner, that's fantastic. And then we have what we call accredited veterinarians. And these accredited veterinarians are basically just more of an outreach of our governmental staff. If you take a look at how many people that we have in the field, USDA only has roughly about 250 veterinarians in the field. And that's about equal to what we have for our state counterparts as well. So we don't have a lot of veterinarians that work for the government that are out there to see what we have going on in our farmsteads. So it's important that we rely on these accredited veterinarians and our producers to report any of those cases. So in the context of reporting those cases, one of the big things is to make sure that we're talking to someone who's the appropriate contact person and has the authority to make those decisions on the farm. Because like what we've heard from some of our speakers before me, we're dealing with some of these farms that are not necessarily a one-person farm. We're now getting into these company farms. And so we're dealing with companies and managers and situations like that. So it's important that we drill down to the person that can make the decisions on that farm for us when we talk to them. So they're like the two speakers before us, they're a litany of questions that you want to ask that person on that farm. But one of the more important things in our world is to find out if there's any sick people that are on that farm, because you certainly don't want to walk onto one of those farms and find out that there's something going on that is zoonotic to the people that may be investigating that disease outbreak. We drill this into our diagnosticians, and that is call the lab, call the lab, call the lab. And the reason why that we do that is that the lab is out there to help the people in the field collect these samples. We've had occasions where our field people may not have collected the right sample, and that's delayed any kind of test results that we may get. So it's important because things change. The laboratory may change. And in some cases, our field people do this so infrequently that it's important that they contact a lab to find out what needs to be done. We are really blessed with the fact that we have this, what we call the National Animal Health Laboratory Network. And it's made up of 60 state and university labs across the United States. And what it allows us to do is to take a sample from that farm and send it to this lab that may be local. And then along with that, we collect a sample that we send off to the national lab. The advantages for us doing it at the local level is that we can get those test results back quicker. And that may allow that state veterinarian to make a decision. Do I need to be prepared in the face of an outbreak, or is this not a case and we can kind of back off of what we need to do? But the thing to keep in mind is we have to have that test result from that national laboratory, because that's the confirmational test that's important. We've heard this morning the discussion about other farms that may be in the area and what are important. Is there a backyard farm that may have pigs next to that commercial farm, or the other way around? Is there a commercial farm that may be in the area that has pigs? And we need to be aware of that when we're talking, doing our investigations. So we like to capture the GPS coordinates of that farm. This allows us to be able to tell the rest of our response group where exactly this farm is. And so they can start doing their GIS work, or producing maps of an area that may include other farms that are there. And we've listened to the other two speakers talk about establishing proper biosecurity. And of course, that's very, very important. Now, I like to call this moment kicking the dirt. This is where you're talking to the producer and you want to establish a relationship, because this is at the point where you're going to ask them questions about what may be happening on that farm. It could be, has that farmer traveled maybe out of the country, or their family has, or what about their employees? One of the biggest fears that I used to have when I was in the field was the fact that, could we have an employee maybe take a lunch product onto that farm that he had gotten when he went back to his country, and maybe perhaps thrown it over the fence in with a group of pigs? And that was how we may be introduced to a foreign animal disease. Then, of course, movement of animals, particularly in this case pigs, is really important. In my home state, we move 37 million feeder pigs into our state on a yearly basis. That's a lot of opportunity to introduce a disease into my state. So it's important to know where animals are coming from. And then in regards to trace outs, where do those animals go? Because we may not only have that index farm to worry about, but we may have other farms that we need to be thinking about as well. And of course, if we're talking about African swine fever or classical swine fever, we need to be thinking about other terms as far as, is this a garbage feeding establishment somewheres nearby? Are they feeding garbage on that particular farm that we're dealing with? Have there had introductions of feral swine in the area? Would that be a potential source of an infection? We like to prioritize our cases, and we do that so that we know what to do in regards to sending the case off to the lab, or what kind of urgency the laboratory needs to spend on the case. So our first priority is what we call highly suspicious. This is where we may think that we may have foreign animal disease. If you were to walk onto a farm or into a slaughter plant such as this and see a vesicle on the snout of a pig, well, that would be concerning. So you might want to think about, maybe we need to expedite this sample to the lab. Priority A is what we call animals in commerce. This could be animals that are at that harvesting plant, or maybe they're at a livestock market, or they're at a public show, such as a fair. Well, those are concerning enough that we need to expedite those samples as well. And then are the lesser priorities, the level 2. Well, maybe it's possible, but not most likely. So we call that a category 2, priority 2 case. And then if they're unlikely, then that's a priority 3, but we still send those samples to the lab. So our priority 1 and our priority A cases, we expedite those to the lab as soon as possible. And this typically is, say, maybe using FedEx, and the fact that they have the ability to send those to our lab in New York but by using a jet. Our priority 2 cases, we can send FedEx overnight. And then our priority 3 cases, the ones that are maybe not likely, we can just do that by standard FedEx shipping. In regards to training, we have a course at Plum Island, New York, that we offer 4 to 5 times a year with a class size of about 24 people. And this is primarily for both state and federal veterinarians. We have what we call a refresher training. This is for veterinarians that have gone to Plum Island and taken the foreign animal disease diagnostician course that need a refresher. Or maybe it's veterinarians that may never have a chance to get to Plum Island, and we want to expand our cadre of investigators. And then lastly, what we're looking at is having our animal health technicians go to this training. So again, we can expand our group of people that can respond to a foreign animal disease. Now, we learned this during COVID, and that was the fact that because we couldn't do our in-person training, we went ahead and we did virtual training. And this is available for a lot of different people, whether it be our federal and our state veterinarians, and we also offer it to our animal health technicians as well. So with that concludes my talk. I'll turn it back over to Erica, and hopefully I appreciate the time that you gave me to allow me to talk about what we do in our country. Thank you, Erica.
Muchas gracias, Dr. Smith.
Thank you, Dr. Smith. Very interesting, very practical presentation. And we certainly see your experience in the field. So thank you very much. Thank you for having shared that. experience of the United States. And now we will offer the floor to questions. We have very many, by the way. So let us try to go through some of the questions that Dr. Andre has been responding in the chat, but perhaps for everyone to hear them. So not only in the Zoom, but through the social media, everyone has the opportunity to listen to the answers. So we will pose these again. So, Dr. Andre, let us start with you.
So, Sean Param asks from Belize, or from Belize, from the Ministry of Agriculture. He asks the following: how can we know the current mobilization situation, the introduction of a disease, of any sanitary problems of dissemination or anything in areas that are undergoing some war and where people are moving from one place to another, and what preventive measures exist for this kind of cases? Go ahead, Dr. Andre.
Yeah, it's quite challenging question because when there is much, bigger disaster than just outbreak of ASF, the priority of government and farmers shifted to, other things, security and safety, and it's very, very difficult to really control movement of people and animals. I just give you one example from Ukraine. For example, Ukraine faced first introduction of African swine fever genotype 2 in 2012, basically in a backyard farm in Zaporizhia area, it's southeast of Ukraine. And that was a success story. And why? Because it was detected very early. It was with backyard pigs of a former veterinarian who tried to, treat these pigs with antibiotics. And after first injection, he realized that situation worsening and pigs died. So he immediately notified veterinary service for, sampling, testing, and it was quickly controlled with, stamping out and quarantine and cleaning, disinfection. But after 1 year, after elimination, it's re-emerged from another site in Ukraine. And at that time, that was detected a bit late. And government was overwhelmed with other socio-political issues. And both veterinary service and extension service and farmers were not really focusing on addressing this introduction and appropriate measures. So when you have, some weather disaster, or you have war or some other emergencies, African swine fever became less prioritized, and then you losing your time, because time is crucial. If you do properly your job at the beginning, it's 99% of your result of your success or failure. And if it's delayed, and another example, for example, Belgium, where they defined relatively quickly cases in wild boar and quickly contained it and eventually eradicated. But when you have late detection, you have other priorities in countries, you have emergencies like war, then it's practically not possible to do it in timely manner. So it's in brief. I don't know if I replied to question from Sean.
Sí. Muchísimas gracias, doctor Andy.
Yes, thank you very much, Doctor. Definitely, that was a difficult question. And the answer is even more difficult. So thank you so very much for giving us those examples. And same person, Sean Barham from Belize, is asking this other question. He says that many countries also face the challenges that you mentioned. And would all these challenges need financing to be able to be tackled in countries? For example, additional personnel, registration, mapping, personnel, vehicles, vaccines, and medications, etc. Are there any financial resources available for countries that are facing this type of situations?
Well, yeah, that's a very valid question. As I mentioned, for most of these activities, you need to have appropriate financial and labor force arrangements, and it's done not during suspicion but before. So it's your emergency preparedness, and of course there is financial, constraints for government to allocate financial resources and technical resources. Therefore, FAO promote public-private partnership to try to find, private sector who might co-share costs. Although it's not always obvious and easy, and work only if there is good relation between government and industry and there is mutual interest on investing in prevention. In some low resource settings, low income countries, we promote community engagement, where we create enabling environment for the communities like villages, when a major of the village and active farmers want to protect their big production. So they agreed on certain measures collectively in the village, in the settlement, and there is FAO promote this participatory approach through co-creation biosecurity plan, which proved to be quite perspective. I don't want to say that it's a golden bullet and it's resolve all issues, but still in a situation where there is no funding from government, help communities to do what's possible and minimize risk of introduction and spread of African swine fever. And FAO launched progressive management pathway for terrestrial animal biosecurity. And one of our pilots actually focusing on African swine fever control in Tanzania, and we piloted this initiative. But there is also a lot of experiences from not FAO stakeholders in Uganda, for example, where this community engagement worked pretty well, specifically on African swine fever in Uganda. Also, FAO tried to promote this experience, community-based, prevention and control in several countries in Southeast Asia. Currently in Philippines, but it will be extended to Laos, Cambodia, and a few other countries. I don't know if I replied, but I would share more on that if colleagues would need more details. I'm available to provide.
No, muchas gracias, doctor Andre. Me parece.
Thank you very much. Doctor, your answer was very clear. What we want to promote are particularly those public-private partnerships for countries to work more with associations and other research institutes. Now, this next question is open to our other panelists as well. Maybe you can give us your opinion with regards to the financing sources. So actually, maybe you can say something about not only getting resources from the government, but from other sources. Maybe Dr. Perez or Dr. Smith have something to say about that. Otherwise, we will continue with the next question. Yes, go ahead, sir. Go ahead, Dr. Perez. When dealing with a suspected case, that is pretty much something that is undertaken by the official sector. There may be a first intervention from the private sector, But at some point, there's got to be some official protocolization so that attention to this suspected case may be valid. And we're also thinking about the circumstances in which there may be some compensation later on. Then the public-private partnerships is maybe more focused on specific activities, that is to raise awareness. And in our countries that are very big or wide, be able to reach those faraway areas. So in that case, we can have an alliance between the public and the private sectors to raise awareness among pig farmers and professionals who may be working in those areas. Also carried out a comprehensive job with regards to surveillance in the area, and also the producers' organizations that exist in those faraway places. But at least from the perspective of these suspected cases in our systems, we always need to have the government involved so that there is a validated attention. Thank you very much, Dr. Perez. Dr. Smith, would you like to elaborate on that or add something?
It's pretty much the same in the United States. It has to be a cooperative effort from both industry, our local governments, and our federal governments, because in the event of one of these, as we know, it's quite costly. We do have mechanisms in place, from authority standpoint, that allow the state and federal governments to contribute to the outbreak, controlling the outbreak.
Excelente, muchísimas gracias.
Well, thank you. Excellent. Thank you very much. Now, Dr. Campuzano is also going to be assisting me in this Q&A session. So, Rocio, I give you the floor. Thank you. Thank you very much. So, Dr. Ruston, this question is for you. What strategies would you use to communicate the strategy plan within the country and with neighboring countries? I think she said Rostalny. I think she meant you, Andre. Thank you. Andre? Andre, can you hear us?
Yeah. Basically, there is generic principles which I briefly mentioned on how to develop communication strategy, risk communication strategy. And you can find more details in specific guidelines, generic guidelines, but also specific, for example, for ASF control in wild boar, for example. And you have key principles, key approaches, and some illustrations of communication strategies which might be useful for you. But first of all, you need to have outcome, what you want to achieve. Basically, our colleagues from FAO call them single overarching communication outcome. It's what you actually want to have as an outcome, that farmers take it seriously, they stop use swill feeding, they improve hygiene and biosecurity, they more cooperative with veterinary service. That's your outcome. And then you try to do another steps on why they need to change behavior, because there is no vaccine, there is big economic impact. Once it's introduced, it's nearly impossible to eradicate. So then you explain to farmers why, when, and what, and you follow all this, logic of 8 principles, which I mentioned. I would strongly recommend that you would involve the communication expert, because we are, most of us, not communication experts. I think colleagues from FOR and FAO, they could provide more on the risk communication. But before approach, I would recommend you to read these guidelines with some illustrations, some examples of risk communication. And you should keep in mind that it's not only for the ASF, but it's for all infectious disease of pigs. And this principle common for classical swine fever, for FMD and so on. So that's my advice. And again, I should be honest with you, I'm not expert on communication, on risk communication. So that's my reply.
Muchas gracias, doctor. Estamos
Thank you very much, doctor. We are aware that your area of expertise is this other part, but we always want to answer all the questions posted. So thank you very much. It is very important for these guidelines to exist that may assist countries. So the next question is also for you, Dr. Rostalny. In a country with very low resources, what would be the most appropriate strategy to develop or reinforce, if there's already one, a response team for a suspected case of ASF or any other type or any other TAD? Your mic is off. Okay.
Yes. Yeah, that's very good question. And taking opportunity, I would like just to draw attention to some of the recent FAO publication on that topic, which is more focusing on countries endemic, which is not maybe very much relevant to your region where you are free from disease. But recently we had a publication on African swine fever prevention, detection, and control in resource-limited settings, where we explore some measures which would be feasible from economic, social point of view in countries where there is limited resources, both at farmer level, but also at the government veterinary service level, to explore various options for public-private partnership, for community engagement, And what we do, we provide training to veterinarians and other stakeholders through FAO Virtual Learning Center. And within this training, we have breakout session groups where countries, not FAO, but countries, share their own experience, how they manage this issue in situation, for example, where ASF is not priority, or there is lack of financial resources, or there is lack of technical resources, expertise. So it's a joint, training, but also self-learning on how to address issue in resource limited situations.
Gracias, doctor. Adelante, Eri.
Thank you very much, doctor. Erika? Yes, thank you very much, Dr. Rostalny, for your answers. And for the material, you can definitely access those links posted by Dr. Rostalny. And for the team who is assisting us, maybe you can copy these links and share them using social media so that everybody can have access to those links. So now we're going to move on to Dr. Perez. Dr. Perez, there's a comment here. I believe people are asking about the link that you already shared, because Dr. Edgar Cuevas from the Secretariat of the Environment and Natural Resources of Mexico says, can you please share the manual that you mentioned in your presentation, please. I don't know if it's in that link that you already shared previously. No. Yes, you can send me your email. I don't know if I can see your email there. I can send it to him. So, Dr. Cuevas, if you can write your email in the chat box so that Dr. Perez can have that and send you the manual of procedures for the notification and management of PPA suspected case. Because right now, the manual is not available at this moment, but I can send it to you. Or I can send it to him. And there's another question here for you, Dr. Perez. What would be the most appropriate profile for the personnel carrying out the field investigation faced with a suspected case? And what would be the qualities or skills that you recommend for this person to have? Attitude is key. Obviously, experience is important, but oftentimes the right question is what makes a difference in these situations. Whenever you're doing an ongoing epidemiological investigation, you need to understand how the disease entered first. So it's not just a single person who would have all the needed characteristics. That's why we always talk about a team. And there may be an ideal person for the sample taking or doing a necropsy, someone who does not make any biosecurity mistakes and knows how to deploy the procedure in the field. And then we also have then those who know how to lead the teams and who have an idea of the right timing to delegate tasks whenever there is an investigation for a suspected case. Because sometimes in the field, you don't have that vision of the circumstances in which a suspected case needs to be handled. And in the field, sometimes people wait for decisions to be made by somebody else, but there are many decisions that need to be made there on the field. I don't know if you understand what I'm saying. And it has to do with the way you act towards a suspected case. At what point you need to do certain or send certain person that who may be the ideal person for a specific task. So in general, it's not a matter of only a person, but a matter of a team, because one single person would not have all those different characteristics that I mentioned. It is important, and I insist, to know how to put this team together and also be in touch with our partners or references in terms of swine diseases or emergencies. And so these people are oftentimes not the ones who make the decisions in the field. There may be other people. So that's where you need to make sure that you articulate with all these different people. Thank you very much, Dr. Perez. That's true. It is a team with different strengths, made up with people with different strengths. So as Dr. Rostanli had to leave, we were not able to say goodbye to him. In Rome, it is very late, so he had to step away. So on behalf of all the different agents, thank you so very much, Dr. Rostanli, for your participation. And now, Dr. Perez, I have another question for you. It says, can you please elaborate on the context of the street light and what may be the consequences of this not being implemented. This concept of the traffic light is a concept that needs to be applied and agreed upon previously with the official and epidemiological people, and also those who take care of food safety and not only of animal health, because they're also going to be talking about the product, and also with the private sector in primary production and the industry, and start describing what are the different situations with regards to movements, what we're going to be finding in the road controls and access points, because we need to think strategically, not only for a suspected case, but in a situation in which there may be an area that may be suspicious, because as we said before, there may be some wild animals who may be introducing the disease in the farms. So if it is contention or prevention measure, it will depend on the plan, and there'll be different risks associated with this. So if a farm is not suspicious or that is within a zone and needs to move animals or products, we'll have to have serological or virological proofs to move animals from one place to another. So this is something that you can agree upon in those terms. Same happens with products. There will be some safe products because as they are cooked, they'll be able to move from one place to another. That is from a buffer to a protection area, and others might not be able to move because they pose a greater risk, or they are not being treated at all. So this is the concept of the traffic light. But it has to do with the permits that are granted and also the controls that may be implemented in if dealing with a contingency plan. Let's remember that I gave you this concept when talking about the exercise that was carried out in Argentina. It's not part of the manual of the handling of a suspected case. Thank you, Dr. Perez. Yes, thank you for clarifying that. And just to remind you that in the chat box, you also have the link for the platform where all these webinars have been posted. So please feel free to go to it, share it in order to be able to share all this information. So Rocio, so Dr. Smith, I would like to congratulate you personally. And also thank you on behalf of everybody who has spoken highly of your presentation. And so the first question says, what would you recommend for countries who are just reinforcing their veterinary services faced with the threat of ASF? Can planning be complex? And the developing of specialized team can be complicated, but what are the topics that you consider to be priority for those who are just getting started in getting prepared?
Well, I would, I guess, coming from a field perspective, I think one of the things to do is outreach to the community, particularly to get information out to the farmers to let them know that, hey, there is a potential of a foreign animal disease. We want you to be aware of it, but more importantly, we want you to be able to report it. I think most of our countries at some level have a response plan in place, but that gap is probably the time frame that it will take for somebody to notice the disease and report it to authorities. And if we can narrow that gap down, I think that's the most important part.
Gracias. La siguiente sería,
Thank you very much. Now the next question. How frequently do you think people should take the updating training courses to the people who want to take courses on TADS?
We offer that course every year and several times during the course of a year, the refresher course. And typically the people that we have coming in is a mixture of people that have never gone to our Plum Island course, but the ones that we bring in for a refresher have typically been out for a few years, and by definition, a few years, 3-4 years at the soonest. But let me reinforce the theory that we think that it's really important that our field personnel educate themselves or do continuing education on an annual basis. We have lots of information that are out there that's available to the public, quite honestly, for educational purposes, whether that's at our university levels or our internal systems as well. We have some great universities out there that have excellent material that individuals can get online. We do struggle with the fact that trying to get our people to do that educational part on an annual basis. Quite honestly, we have individuals that don't do a foreign animal disease investigation for years. And so we think it's important that they keep up on that educational component.
Gracias. Hay otra felicitación.
Thank you. There's another commendation here. There's another comment. It says, I think that the recommendations that you made on the first interview with the producer is quite adequate. Does EFIS use anything in particular for the veterinarians in the team?
Okay, my apologies. I'm not quite sure I'm understanding the question.
Que si el USDA tiene un perfil.
Does USDA has a profile for the personnel that will dedicate itself to be part of the teams? Any profile, specs of the veterinary, any qualities that you look for in this person?
Yeah, that's a really good question. One of the things that we have going on right now is our state counterparts, when they hire a veterinarian to come in and work for them, they typically are veterinarians that have been in the field for a number of years, doing practice work, working with large animals. So they come in with a lot of experience. It seems that on our federal side, we have that to some extent, but for another part is that we have a lot of individuals that are coming right out of veterinary colleges that are coming to work for us. And they may not have that large animal experience. And that, from my perspective, and this is entirely my opinion, that's hard sometimes to get the information that we need across to them to bring them to a level of that they can respond adequately, I think.
Vamos muy rápido, ¿te parece?
There are two more. Let us go through these quickly. Yes, quickly, because we are way over time. The first one, Dr. Smith, is what recommendations do you have, some strategies to ensure the collaboration of research institutes and universities as part of this epidemiological surveillance and addressing suspicious cases?
Well, I think that we have a great relationship with our universities. Remember that a lot of our universities are what we call land grant universities. So they were established from an act that was brought in during Abraham Lincoln's time frame. So we're talking the late 1800s. With that, we've established a relationship not only with USDA because we fund a lot of their projects, but also from the state level that they're interacting with those universities too. And we wrap all that in to we have our Nolan laboratories, that National Animal Health Laboratory Network. They are an important part of what we do from an investigation standpoint. So there's a relationship there. We have a relationship with our extension specialists. These are individuals that go out into the communities and talk to producers. So there's a lot of different ways that we establish that relationship between universities and our government entities. And we think that's a very important part of what we do to help not only prevent a disease, but in the face of a disease outbreak.
Sí, exacto. La pregunta seguramente es porque
Yes, that question precisely, I would imagine, was because in some countries, they do not have that close relationship with the universities during an outbreak or to carry out the research. So I would imagine this is more work done only by the officials, personnel, and that is why what your answer is so important. Thank you very much. I guess the next one is a question from Gideon saying that in the past there was training in Plum Island for the officers of the Foreign Veterinary Services. And since now the training courses are virtual, are you also considering the foreign officers for that training?
That's a very good question. Let me reach out to our training staff at Plum Island and see if that would be a possibility to do that.
Gracias, Dr. Smith. Son todas, Eric.
Thank you, Dr. Smith. I guess those are the last questions. Go ahead, Eric. Thank you, Dr. Smith, Dr. Perez, and Andre. All this information you have shared with us today is very good, very valuable. The mission of these webinars is to prepare all countries to prevent and to respond to African swine fever or any cross-boundary disease. So there is all kinds of training. Well, we have been going at this for over 2 years, and all these materials are on the platform that has already been shared with you through the link. So please visit the website, share. These webinars will continue next year. So for the time being this year, I would like to thank those that have been with us today and those that have been with us month by month, covering all the different subject matters. I would like to thank all my colleagues from all agencies for enabling these sessions and that we have such top-level speakers. So I would like to thank all the agencies that are part of this interagency group and all the ICA staff that behind scenes are always working so hard to take these webinars to all of you. So with this, thank you all very much, doctors, for your help. Happy holidays. That is just around the corner. So a strong hug to you all and see you next year in February. We would start in February. So goodbye. Thank you all very much. Thank you, Dr. Campuzano. Thank you all.
Thank you.
Congratulations. Thank you.
Gracias.